Cammie Wolf-Rice, and I am the CEO and founder of CWC Alliance. We are a nonprofit and we're based in Atlanta, Georgia. And I'm here today to talk to you about our mission and innovation of a new position in healthcare. But before we get started, I like to start with our why. And this is my amazing, handsome son, Christopher. And he had a health crisis. And unfortunately, he went into the hospital to have his large intestine removed. He had ulcerative colitis. And it was right when Purdue Pharma released Oxycontin as the wonder drug. And we went home with 90, followed by more hospital visits, more complications, more opioids. And he fought it for 14 years. We didn't even realize that he had a problem. We didn't know anything about addiction. I literally just followed the physician's instructions to give him those pills every 4 hours. And unfortunately, he passed away September 20. I'm sorry, that was his birthday. He passed away February 26, 2016. And for 2 years, I sat in fetal position and I actually didn't talk about the overdose because of the stigma that is related to addiction. And sadly enough, I wanted my son to have a respectful death. And then in 2018, I was like, okay, I've got to walk the walk. I've got to talk. I've got to share my story. And we've got to do something about this opioid epidemic. But when we talk about stigma, what do you think when you hear the word addiction? Just think about that for a moment. Some of the words that some people think about are moral failure, weakness, it's a choice, it's a bad choice, criminals, reckless, lack of willpower. And that's why I was afraid to share Christopher's story because of the stigma. More than 50% of Americans reported addiction is caused by a person's bad character or lack of moral judgment. My son wanted to be a Navy SEAL. He was the most disciplined person, and he fought it so hard. And I hated the stigma that was around it. And I didn't share it with others because I didn't want them to think bad of my son. And if I would have said my son had cancer, I would have had casseroles at my doorstep. I would have had that support, but I hid it again because of stigma. The words that we need to change in our vocabulary is that recovery is real, it's preventable, it's treatable, it's a patient safety issue, it's a trauma response to a root cause. When stigma decreases, substance use problems decrease. We have to stop the silence because silence is deadly. Let's talk about the problem. And I'm sure all of you that are in healthcare are fully aware of the issues, but it's good to just run over more than 125 million opioid prescriptions dispensed annually. Are they going down? Yes, we are seeing a decrease, but there's still overprescribing that is happening every day in our nation. And it's estimated that more than 16 million Americans misuse their prescriptions and their medication given every year. Nearly 80% of heroin users started with an opioid prescription. That's exactly what happened to Christopher. When he couldn't receive the prescription any longer, he then went to the street. He was able to get it cheap and easy. And I never in a million years would dream that my son would do heroin. But again, the prescription led to that heroin. Less than 3% of all healthcare spending goes to prevention. So I like to always say our swim lane is prevention because we have to stop it before it starts. We have three pillars at CWC Alliance. We have developed a new position in hospitals called the Life Care Specialist, and I'm going to really dive into that. But we also have the Youth Prevention Network, where we've taken all the training that we have for the life care specialist and put a youth-friendly wrapper around the training. And we teach young people to be trainers. We certify those young people to be able to talk about the dangers of opioids, to talk about fentanyl, to discuss Narcan, and it's peer-to-peer led because young people are going to listen to young people more than they will adults. So we also have the Youth Prevention Network. And we have workforce innovation, where CWC will go in and we do workforce seminars and lunch and learns and training on pain management, on coping skills. And I have a slide that get more in detail on that. So let's talk about the life care specialist. We know that our society, we use coaches for everything. Every sports team has a coach. There's executive coaches, lactation coaches, workout coaches, sleep coaches. But when you're in a health crisis, is there a coach at patient bedside? And when I put this all together of what I felt was missing from the healthcare team, from the multiple times of being in the hospital with my son, I based everything on this position on everything I felt like my son and I did not have when we were in those hospitals multiple times. So, number one, we do opioid safety education. Look, there's a time and a place for opioids, but if you have to be on an opioid, you need to know how important it is to taper off quickly and don't use it as a sustainable plan. We also teach about fentanyl and naloxone. Again, we're there to help that patient manage their pain. Set a clear expectation. You're in the hospital, you're having a health issue, there is going to be pain. It tells the body where to heal. But it's not only the physical pain, but it's the mental and emotional pain of having a health crisis and being in the hospital. All the life care specialists have been trained from the Trauma Resource Institute. We're all certified with coping skills at the patient bedside that we can teach these mental wellness skills and resiliency to help them regulate their nervous system. So those are basically the three pillars that the life care specialist does at patient bedside. We call this our healing wheel. And look, everybody deals with pain differently. Some people have a higher tolerance than others. And so we have a toolkit, and it's a healing wheel with many things that are in there. I'm not going to read off every single thing on this slide, but what I will tell you is when you work on a personal pain management plan with the patient and you include the caretaker and you give them some support as well and give them resources, and one of the most important message on this wheel is having a listening ear, providing a listening ear, validating that patient's pain, letting them vent, having the time to spend with them. We're not there to poke and prod. We're not rushed. We don't have other patients to rush down the hall to get to. So we're able to build a rapport and trust with that patient. And what happens is we end up uncovering all these other comorbidities. It could be food insecurity, home insecurity, domestic violence, or we might find out that there already is a substance misuse issue, and we can help to get them resources where in the past that patient would fallen through the gap and been discharged, and those issues would not have been identified. We're always looking at new innovative things to try to deal with pain. And our culture has been brainwashed to think if we have an ill, we go to get a pill. And it's really changing a culture, which takes time and effort, but it's doable. The life care specialist goes through a very robust training. And my background, my career, I worked for a high-end software company and I managed IBM and Accenture and Deloitte and Ernst& Young. And I didn't know that I was in training for what I'm doing now because partnership is key to the expansion and the growth that we've had at CWC Alliance. We wouldn't be where we are today if it wasn't for our tremendous partners. Grady Hospital believing in us, We started a clinical trial there right during COVID, and they let us keep going. Mercer School of Medicine, the Trauma Resource Institute. So this is the modules that a life care specialist will go online. There's 13 modules. There's a quiz after each module. And then we have clinical rotations and practicum at Grady. I'm also excited to announce we're working on a partnership with the technical colleges of Georgia, where this will actually be a certification that you can receive at a technical college. And it's the first one in over a decade of building that workforce development and having a new career for people, individuals. And I do want to point out that Dean Sumner at Mercer School of Medicine, I didn't know healthcare pins was even a thing. And she surprised me on Christopher's heavenly birthday with a healthcare pin. So all of our life care specialists wear my son's face, and that is his legacy. And so that was a very special moment that I love to share. It's all about the data. Our long-term goal is to get a billing code for this position. We've been able to get opioid abatement funding and private family foundations. I met with over 150 medical professionals about adding this new position to hospitals. And I said, put holes in this. Tell me what's wrong with the plan. And they all said, it's about the money. And we've been able to find the money and sustain the position. We have served almost 7,000 patients last year. I think the number would even be much higher, but some of our rural hospitals have a low volume. We're in Grady, we're in Emory, we're at the four, you see the four hospitals in rural Georgia. We also have expanded in Arkansas. Arkansas is the number one prescriber of opioids in the nation. I believe we're there for a reason, and we plan to expand and have them in all hospitals in Georgia, all hospitals of Arkansas. We have the states behind us, and we're moving into Tennessee. We want to expand. Again, the North Star is to have it in all hospitals across the nation. So this is some preliminary data. One thing to point out, if you look at, we had 1,155 patients connected to care. Again, that's when we uncover the needs that have nothing to do with their health crisis, but that they need resources for. So super proud of those numbers as well. 89% of the patients we did a program evaluation reported that a life care specialist was helpful in managing their pain, and that 93% would recommend a life care specialist to a friend, and that they understand what medication that they're taking. At our first clinical trial at Grady, we had a 25% reduction in opioid utilization at discharge. That's amazing. I always like to share stories, and I'm gonna, we always talk about resourcing and helping patients to think about a resource that brings them joy or peace or happiness when they're in pain. And we had a patient, and she was in extreme pain. And it was very hard for the life care specialist to get her attention to talk about anything. But she did mention gardening, that she loved gardening. The life care specialist went above and beyond. She went and bought some soil and three little plants and brought them in. And the woman put her hands in the soil. They potted three little plants. And that woman did not talk about pain for an hour and a half. And she had those little plants right there at a patient bedside. And the life care specialist was elated. She said she didn't talk about pain. I come in the room, she starts talking about how the plants are growing. And again, that was a resource for her. Another instance, a life care specialist was explaining to an elderly man, and he was honestly a little grumpy with her. And he said, I don't need naloxone. And she was like, well, I really would like for you to fill out this form. It's free. And the son was there with his father and said, Dad, why don't we go ahead and do this? Let's go ahead and get the form. And he said, well, I don't need it. I don't need it. Well, he came back into the hospital 2.5 weeks later. He asked to see the life care specialist. And with big tears in his eyes, he said, I just want you to know I was nasty to you when I was in here before, and I didn't want to talk to you. And he said, you saved my life because I overdosed and I went into seizures. And if my son didn't have that naloxone at home, I don't even know if I'd be here today. And that was a testimony of a saved life. And so You can have all the data in the world, but when you've saved a life, that was unbelievable. And there is a lot of cases where our elderly are overdosing because they don't understand or they're taking their medicine along with other medicine. They forget that they take it. I'm a firm believer that everyone should own naloxone as it tells your lungs to breathe, and it's important. It should be just like you have in your first aid kit for everything else that you should have at your disposal. The other story I like to share, and this story was actually featured at WebMD. I got a call from another hospital where we didn't even have a life care specialist, but the doctor was familiar with our work. And he said, Cammie, I need you to come out here and bring one of your life care specialists. We have a 21-year-old, and he got hit by a truck on his moped, and he has been so heavily overprescribed. And I've eliminated all the issues of pain, but I think he's already addicted to the opioids. Can you come out and talk to his parents? Can you talk to him? So of course I jump in my car. The mother comes out in the hallway. She tells me she has over 100 Oxycontins at her house. Over 100. Now, this doctor that called me was not the one that prescribed the opioids, but another doctor had. And I'm sitting there going, wow, here we are 25 plus years later after my incident with my son, and it's still going on. There's still overprescribing that is going on. We have to get better. We have to educate patients to be their own health advocates so that they can ask questions. Dentists sometimes are, not all dentists, but dentists are some of our highest prescribers. We have to educate moms, parents, and youth that you do not need an opioid when you're having your wisdom teeth. It's Motrin and ice. There's no reason to go home with 35 Percocet. That's so many times I've talked to young people in rehabs. They're in a rehab because of a dentist procedure. So we have to get better. We have to educate. It is preventable. And that's why I really like to share specific stories. We have so many of them of success. We've done many research trials. We have 99% improved pain management. Again, I've already told you about the 25% reduction. We continue to do trials because you have to have the data to get the insurance billing code. And we want the data. We want to prove. But it's challenging, to be honest, because when you're in the prevention lane and you prevent something that didn't happen, how do you prove that it didn't happen if it didn't happen, right? So it's challenging, but we are written up in medical journals and we are on our way to more. So very excited about that. The silver lining, let's just talk about nurses. If you're a nurse watching this right now, I get emotional when I talk about nurses because I could not have survived as Christopher's mom without the amazing, incredible nurses that helped my son and that helped me get through horrific health crisis time after time. So I had your angels on earth. Let's just say that. But the silver lining for the life care specialists, we're able to give respite to nurses. These are actual quotes from nurses that we work with. When I have a patient experiencing pain, the only thing we have is to give an opioid. And maybe if we're lucky, we can find a heating pad. Other than that, I have no other way to help them. Now they call the life care specialist. I'm going to read them because it makes me so happy. It makes my heart smile. When you've got multiple call buttons going off in difficult cases, call the life care specialist. They will be your lifeline. That makes my heart sing. I became a nurse to do all these things that an LCS does, but I don't have the bandwidth or the time to do it. So what we want to be a part of that healthcare team. We're pioneering a new position and we definitely work very closely with the nurses, and it's so critically important for the program to be successful, to be that partner at the patient bedside and to give them respite. Excuse me. I won't read off all the items here, but this is the workforce training that CWC does. We do in-person training, we do seminars online. Zoom is great. It's allowed us to do training in Nevada with an opioid excellence center that we never even met them in person. We did the whole 6 series online without ever even meeting in person. So these are the items that we do train on. And one I'm most proud of with our resiliency training, that's to deal with anxiety, stress, depression, PTSD. We all have anxiety at some point. We all have stresses in our life. And these skills are meant to be simple because when you're having a panic attack, when you're having heavy anxiety, you need something simple to reset your brain and we've trained over 3,000 health workers. And so one of the stories from that is during COVID, when we went through the training, one of the nurses shared with us on Zoom that there was an exercise when you're feeling just at your wit's end, okay? And she was having patient after patient die. And she would go into the janitor's closet and she would literally push against the wall because that's one of the exercises. Obviously, we don't tell patients to actually do that when they're in a hospital bed, but you push against the wall and you put all of your anger, all of your frustration, all your fear into that wall. And she would go into the closet when she would lose a patient, push against the wall, take her breathing exercises, and go back out on the floor. And then another patient would die, and she'd go back in and push on that wall. And she said that's how she got through COVID as a nurse. So I know that the skills work. And again, they're simple to use. And we've trained over 3,000 frontliners. So super proud of that. And this is the app of the training that I was just referring to. It's called the iChill app. It is free. So when we teach these skills at the patient bedside, then we're able to help them if they want, if they choose to download this app for free. And that way they can continue to use the skills when they get home. Specifically, the grounding exercise, it's got the most calming voice. The co-founder, Elaine, it's her voice, and she takes you through a whole grounding exercise, and it's just fabulous. So we also have the life care specialists use these skills for self-care for themselves because they're taking on all these patients' problems, which I'm sure you all, if you're in the healthcare profession and you're watching, you take all that on and you have to take care of yourself. And so I highly recommend these skills for self-care as well. We also have a resource library that we're constantly updating. And so we have 2 QR codes. Feel free to take your phone out and to scan for the library and for the iChill app. This is our brag slide. Look, I picked the hardest thing to do, and that is to develop a new position in healthcare. And I didn't do it alone. We have an amazing advisory board, but I truly feel like if Christopher would have had a life care specialist, if I would have had a life care specialist as his caretaker to warn me about tapering him off those opioids, to give him those coping skills at bedside to deal with anxiety and stress and depression, I would still have my son. And I can't get my son back, but I can save somebody else's. And so that's my mission. And so I'm okay to brag. This is a brag slide. I'm super happy about this slide. We've been featured in WebMD. We're in a documentary with Channel 2. Harvard Business School has done a case study, and because we had 300% growth, they have decided to follow us on our journey of bringing life care specialists into every hospital. The bottom line, HRSA and Emory and the NFL, those are our research trials that we have done. And we're currently in a new trial with Emory. And it's basically based on this surgeon that does knee replacement. He only prescribes 2 opioids. And I said, well, how many patients call you back for more refill? He said, less than 5%. When you go home with two, mentally, your mind tells you, my pain might get worse, so I'm going to hold off. I'm not going to take that pill unless I really, really need it. And he said, less than 5% call back. And some of his counterparts are prescribing 80 opioids. So again, we're not wanting patients to suffer. We're not wanting them to be in pain if they need to be on an opioid, just how quickly they need to taper off. And can you get by without taking the opioid? that's always, there's a lot of side effects to taking opioids as well. So those are our clinical trials at the bottom. And this is my book. I never thought I would be an author, but the reason I wrote the book is I wanted to get to the masses. I feel like there's a fire inside of me. This is the largest epidemic our country's ever seen. It's like a 747 flying into a mountain on a daily basis. It's the number one killer ages 18 to 45 in our country. If you look at the fentanyl crisis, we didn't talk about that today, but I do a lot of advocacy around fentanyl awareness for our young people. They're targeting our young people. They're experimenting for the first time. They're getting a pill that looks like a Skittle and it has a speck of fentanyl in it, and it's killing our young people. This book is about my personal journey with Christopher, but it's written in a way that the reader thinks about their own journey. And I use an analogy of a flight, like our lives. We land at different places in our life. We land at happiness and success and grief, sickness. And we all have turbulence in our life. And how do we get through that turbulence? And how do we keep refueling? And how do we keep flying? After each chapter, there's also a QR code where I have a video doing a little summary because some people don't have the time or want to read. And then there's a resource library that's in the back of the book that we continually upgrade. All the proceeds go to the charity. That's the only reason I'm sharing it. If you know somebody that's lost a family member or a loved one, I feel like I've written my soul in this book to help others. That's the purpose of the book. And it's also available in audio as well. I would love to connect with all of you. Please connect with me on LinkedIn. There's the QR code. Please follow us on CWC Alliance. We do a lot of educational material. We would love your support to follow us on all platforms, LinkedIn, but we're on Instagram and Facebook as well. I would love to connect with each and every one of you. And this is our team, and we're continuing to grow. And I really want to thank this organization for giving me this opportunity. Anytime I get the opportunity to share our mission, I am so grateful and so thankful. And I look forward to hopefully meeting you someday. Thank you so much.